So this is the chiropractic table that we will be using with therapy with our pregnant mamas. The great thing with this table is we're able to drop down this middle piece right here to accommodate for the tummy. It allows me to work on the lower back, work on the pelvis while the mother's in a nice relaxed position. We're actually also able to adjust the upper thoracic segments as well as get our hip adjustments as well. So since we're unable to take x-rays of the spine, we're going to be doing a little scan of the body to see the tone, check the movement of the spine. If there is a hip that is not moving properly, we want to feel for that before we adjust. Nadia has a lot of tension up through here. She worked as a dental hygienist for over a decade prior to us having this little one. So this was always a chronic condition prior to, so we'll definitely be addressing this issue as well. We then want to come down to the legs, check to see if her pelvis is level. We do that through a leg length test. So she's displaying a short left side, and we can see as we come up, it remains short. So that means there's a little bit of pelvic dysfunction on Nadia. So first, let's work on some of the muscles down there. We have a vibration tool, but I can also use my hands if this is a little too stimulating. We're not going to be going too deep on the hips. Nadia's sits bones are always a little bit tighter, so we generally want to keep a light hand on this. In time, what happens with at-home routines, ball exercises, pelvic floor stretching, breathing techniques, we are able to loosen up this area. And then whatever we do on one side, we're going to do on the other side. And just a reminder, this is the hip that Nadia has some of her discomfort on. She attributes it to some of her sleeping positions that she's in. And now quickly we'll address the tightness up here because we will be adjusting it. I like the muscles to be nice and relaxed before adjusting. I find that we get a more sound adjustment, and in that region, the joint tends to hold a little bit better when the muscles are a little bit more relaxed. So we'll just scan through here. We're seeing how Nadia reacts to the tool too, so we know that there's a lot of tightness up there based on how she's moving. Right there, so you can see her shoulder move, so she has some tightness through there. Another fantastic thing with this table is now we're able to address her lower lumbar pathology. So we're going to be stretching at those segments to try and open up the disc space. And I'll try and show you a model of that here later. So I'm holding on to her upper lumbar spine first, just to kind of check the movement of the spine. How does that feel on your belly? Does it feel okay? Good. And Nadia's 36 weeks now, so we're just doing more maintenance care. With this stretch, normally we'll just feel a little bit of it's almost like a very focused pulling at the lower back. We're trying to give that disc, it's been compressed, it's been stretched during pregnancy, and we're just trying to give it a little bit more functionality to prepare for the birthing process. We're going to be doing a little bit more focus on her right side. And on this side, I can feel the band of muscles. They're just a little bit tighter. I'm gonna do one more stretch here. Good. Okay, so now let's lock up the table. We're going to be addressing the tightness up here at the upper back. So usually I'll focus adjusting kind of in this region right here. I don't want to go too low to put too much pressure on Nadia's abdomen. So with the vibration, we saw that she had a lot of tension up through this area. So this is where we're going to be doing our first adjustment. Whenever you take a nice breath in for me, relax that all the way out, let it all go. We have our pressure and follow through. And we'll do one more breath in, all the way out. There's that pressure. It actually moved on setup. Perfect. And how did that feel on your belly? Was it okay? Good. So now we're prepping Nadia for her side posture, SI joint adjustment. We added a little bolster or a pillow here to support her stomach. And what we're going to be doing is we're going to be tractioning a little bit on her upper body, focusing on that SI joint, rolling her just a little bit, leaning way over and getting that movement. Good. So now we'll be addressing the adjustment on her opposite hip. We're going to roll her just a little bit, get right over that hip. Good. Nice. So Nadia does have a lot of neck tension just due to her occupation as a dental hygienist. She's always leaning forward, assessing and cleaning. And it's been very tough on her upper back, so we're palpating, feeling for that restriction. We're gonna set her up. And do a nice light adjustment of her upper cervical spine. And this next part's very important as well, because as we're carrying the baby, what happens is the body wants to kind of come inwards. So we'll see, look at my shoulders, how they kind of round out like that. The shoulder adjustment and the rib adjustment does a good job of opening up the pelvis, giving Nadia that nice, strong posture. So we'll have her come up into this position right here. I'll just slightly roll her, palpate the area, feel for where that restriction is. Have her relax into that movement and make the adjustment. Good. And we'll do that on both sides.